Lift it up. You can feel that, right? So left side. Okay, good. Now the right side. Yeah, you can't even lift it. So there's something going on in the lumbar spine. Now I'm gonna poke around a little bit. Is it buggy in here? No. So I'm gonna poke around here. Not sensitive here?
No.
How about right here?
No.
5. How about right here?
No.
Here? Okay, good. And then when you were mentioning the upper back, are we as high as up in here?
Yes.
So mostly like right there.
Right there.
Right there.
At the bottom.
Okay, so what we're gonna do is you're an excellent candidate to unload and decompress the entire spine. We're gonna start with the ring dinger adjustment. I'm gonna get you on the table, we're gonna get you locked in, and we're gonna pull. I'm gonna pull as hard as I need to. And if we don't get it on the first attempt, I'm gonna try again, okay? But it sounds like you have years of tension here.
Yeah.
All right, so let's sit up straight. All right, today I'm here with Eric, he's a new patient. Interesting case, you fell off a ladder 30 feet high, landed on your back. Off a scaffolding, and had lots of back pain, multiple herniated discs in his lumbar spine and his neck. And what was interesting, what you were saying is, when you anytime you sneeze, cough, or take a deep breath in, you feel numbness and tingling down both your hands.
Yes.
Haven't had a cervical MRI yet. Okay, but usually what that tells me is that there's neck involvement on the discs, pressing some nerves down the arm. So, we did an evaluation, found that he's an excellent candidate. We're going to start with the ring dinger. And the reason you're here today is you're seeing the videos online of Dr. Aaliyah in Dallas. He's very prolific about putting content out. So keep your fingers interlocked, just rest them like this. As you saw in the video, I'm going to put these pins above your crest. They're going to be tight, it's not going to be very comfortable. As soon as I adjust you, I'm going to do my best to take them out right away. Okay, so take a nice deep breath in and let it all the way out. All right, that one's in there tight. So multiple herniated discs in the cervical, which is the neck, and the lumbar, which is the lower spine, with pain almost all the time. Breathe in and let it all the way out. All right, that's pretty snug, right? Mm-hmm. Try pushing yourself up towards your head and see if you slide. Not really. Okay, so I'm gonna get in here, and like I tell everyone, what I want you to do is just keep your mouth closed. I don't need you clenching your jaw. Just keep your tongue inside your mouth. And have you breathe in and out through the nose and through the nose only. And when I tell you to wiggle your toes, or Dr. Aaliyah says make your belly into a jelly, I'm just going to say touch your toes together. Okay, that'll just give me that what's called cortical distraction, so I can break through that barrier and really unload. All right, that's going to go right there. That's going to go here, and this is going to go here. There we go. Okay, good. Breathe in. And all the way out. Good. Breathe in again. And all the way out. Wiggle your toe for me. Wiggle and drop it. Okay, good. Good. Breathe. Where did you feel that release?
Lower lumbar.
Lower lumbar.
A little bit on my neck as well.
Good. That means I got it. So that went all the way down to the lumbar spine.
Oh, man.
Rest right there. I don't want you to get up, I don't want you to move. And what you've seen in the videos is most of the times we do this, it's not just a one and done. It's a couple visits done out, usually 6, all right? So now we're gonna get the rest of your cervical spine. Take a nice deep breath in, don't help me. Okay, you had a big one right here, the 3rd and 4th cervical. Got this. That was lovely. That moved nicely. And then we're gonna get really low. 2, 3, drop his head down. Even better, stay right there. Good, good. Intact reflexes. Okay.
Oh, that was great.
Happy with that?
I felt all throughout my spine, but mainly the big crack was in the lower lumbar and up here.
Right?
Yeah.
Good, okay. Now, what I'm gonna do is I'm gonna lower the table.
Okay.
And then you're gonna turn your whole body facing the window. So turn completely on your side, and then you're gonna push up to a seated position. Push yourself up, you're gonna hear push here, and you're gonna push yourself to sitting, and swing your legs off the table. Rest there for a minute. And then when you stand up, I want you to describe what you're noticing.
Feel lighter.
Okay, lighter. I hear that all day, every day. The reason you're feeling lighter is because your body's better dealing with gravity. Right now, what happens is gravity pushes you down, you know, but that just opens things up. So you feel lighter.
Feel lighter. Decompressed completely from the neck. And somewhat of my mid-back. My standing feels different.
That's something that also I hear. Like you're more, your feet are planted to the
I feel
floor.
more normal.
That's it.
To what I'm used to.
That's why we're here. And for the viewers out there, he's paying to be here. He's not an actor. Everyone's like, oh, I didn't tell you what to say. You're paying to be here. These are words straight out of your mouth. So now what we're gonna do is we're gonna jump on a table, face down. I'm gonna adjust the entirety of your spine, and then we'll do some more stuff. People coming from Albany, they're coming from Niagara Falls, they're coming from New Hampshire, DC. They're coming from faraway places. They have real problems, and they're paying real money to get adjusted. You know, I don't have a full-time cameraman like some of these docs.
And my headache completely went away.
We're at the cost of admission right there. All right, head down in the middle, drop your arms down. So what I'm pointing out when we first did the leg check, right leg is short, still there, you know, still there, still there. So now we're gonna do that leg check to see if it's easier for him to move his legs. So do that right leg straight up, this one. Remember how I had you lift it? From the butt though. So lift it up, yeah. That still looks hard to do, put it down, and then do the other one. That's still a little bit better than before. So now I'm gonna do the drop technique, okay? So you've seen this in all the videos. Good. So both Dr. Johnson and Dr. Aaliyah have an air drop table. Mine's a manual drop table. I happen to really like that drop. Good, so we're gonna go 5, 4, and we're gonna get right into 3. Good. I'm gonna switch sides, and I'm gonna right into, what I think is easiest is I'm gonna have you bend your knees like this when I tell you to.
Okay.
And I'm gonna try to get this transitional area. This is a really, really hard area to adjust. Okay, breathe in for me. And bend those knees, let your air out, bend your knees, good, down, good. Good, put them down. That was not too bad.
No.
Okay, try lifting that right leg up again if you can, the way I showed you the first time. That's better. Put it down, now the other one. We're getting there, making progress. So we're just gonna go. And then we're gonna try and get this upper area because it's so bunched up. Let's see if the modified diversified can make an impact here because it is so punched up. Oh boy, stretch. Good. And bunched up. Drop his head down. Good. All right, good. Take a nice deep breath in. And all the way out. Good. All right, flip over, lay on your back. As you can tell, I'm working. You know? Has any of the other chiropractors you've been to done any of these things that I've done to you? What were they doing?
Just normal adjustment. I mean, legs up, come behind me, kind of hug me.
Gotcha. Drop this. So you should feel this into the knee, into the hip, and if we're lucky, into that lower back. Drop this. Wow. Did the camera pick that up? A little bit. Where'd you feel that release in there? Into the hip?
I think all throughout.
Yeah. Even better. Good. Give it a little room in the knees.
Yeah.
A little room in the hips, a little room in the lower back. Good. Good, stay right there. Yeah, you know, I'm blessed. We have people coming from all over the place. And it's actually fun coming to work now because we help people. All right, good. Now you're going to sit up slowly facing the charts. And I'm going to look at your shoulders. And then I'm going to do some instrument work. Good. Practice. You're not the biggest guy we had. We had a guy today, 335 pounds, 6'4". Big dude. Take this elbow, let me have it here. This shoulder's good. I'm down. And he said no one's ever adjusted him like that before. Drop this. Okay, good. Now we'll do the instrument. I usually do the instrument standing, but I think for you I want to do it sitting. All right, so this is called the arthrostim. Good. Doesn't hurt. Gets movement right in there. Good. I'm looking for a change in pitch. Good. All right, now stand up, move around. What's different? Because you said that you're lighter on your feet. How's your flexibility? How's your mobility?
My neck immediately, I don't have to push it. Normally I would have to push it like if somebody was holding me back.
Mm-hmm.
Like I said, my headache just completely went away.
Yeah, chiropractic is known to cure, I don't like to use the word cure, but resolve headaches for sure.
My eyes aren't bothering me no more. I don't feel any pressure. Normally I have a lot of pressure here. Oh, this feels great. I do feel a whole lot looser.
Whole lot looser. Try when you said to sit and try to put your socks on type of motion. Let me see if there's an improvement there.
Yeah.
You can do that now.
Yeah.
Try the other one. A little harder on
And
that
this
side.
one's a little harder.
Like I said, you've been like this, you have some serious trauma.
Years.
There's a reason we want to see people 6 times. There's a reason in it. So today is Thursday. I'm back in the office next week, Tuesday, Wednesday, Thursday. Do your best to get here a couple times, and it will continue the process. But the reality is when we adjust your spine, I expect you to be sore tonight. When you leave here, try to drink at least 64 ounces, just so you know this is about 24.
Yeah.
So 64 is a lot of water.
Yeah.
Flush it out of your body. Tonight when you sleep, you should get a really good night's sleep. And if you're sore in your neck or you're sore in your lower back, or you're sore anyway, highly recommend icing. 20 minutes on, 20 minutes off. And we'll give you some tips and tricks you can do in between your visits, because what's going on is you're very forward. I want you to spend a little bit more time in extension. Most of the people out there watching this, their whole life is here.
Yeah.
Either looking at their phone, looking at their monitor, looking at their keyboard. So every day, try to take your head and just tilt it back a little bit into this extension move. As we progress through care, it's gonna get easier and easier,
Yeah.
but we're just spending too much time. So let's just stand up again, and I'm gonna do the instrument one more time, but standing this time, okay? And then take your head and kind of take your chin and push it back this way, and then bring it back. And when is the neck MRI scheduled?
I gotta, they want me to do PT first
Gotcha.
before they can do the MRI for the neck.
That's another thing when I notice a lot of people say, oh, a lot of people, it's hard to get an MRI these days with insurance companies. They want you to do a month's worth of physical therapy before they even authorize. The great thing about us is I already know based on your symptoms that you definitely have disc involvement. And it's not going to change the way I treat you. We have people coming in all the time with MRIs that show multiple level disc herniations, and what we're doing is getting them feeling better. You can have your body back, walk around. When you came in to where you are now, what's different? Like what percentage improvement would you say you have?
I would say 80.
Damn, I'm happy. I'm usually happy with 50.
Nah, I can say 80.
I'm happy with that. 50% I usually go for one visit, but 80
Yeah.
is good. Just be aware that when you leave here, the pressure comes back. That's why we need to do this a couple times. All I ask for is over the next couple weeks, a couple times a week, and we'll go from there.
Yeah, because I normally, sure my wife will tell you, I walk holding my breath because of my tightness and my pain half the time.
Well, right now, when you leave here today, what I want you to do is I want you to walk not holding your breath, and I want you to walk like a human. What I mean by that is, not on your phone, not holding a lot of bags. Walk with your arms swinging. Take normal, nice strides, and that's what I want you to do when you leave here. Normal, nice strides. Go home and get some sleep. No alcohol tonight. Don't train if you train. Go home and rest. You're in healing mode.
Okay.
All right?
Thank you, sir.
You needed that.
Appreciate it. Yes, I did.
It's good. Good.
So I can't wait to come back, honestly. I feel good. Yes, sir.
Awesome. Yes, sir.